This meeting of the Ramsey County Board of Commissioners is now called to order. Stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Would the clerk please call the roll? I think I did that backwards, but...
Here.
Maris Castillo.
Here.
McDonough.
Here.
McGuire.
Here.
Ortega. Reinhardt.
Here.
Carter.
Here, thank you very much. The agenda for September 7th is before you for approval.
So moved, Madam Chair. Second.
Thank you. Is there any discussion on the agenda? Thank you. Will the clerk call the roll?
Reinhardt.
Aye.
Fretham.
Aye.
Maris Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega. Carter.
Aye. Thank you very much. The agenda is approved, and the minutes of our August 24th meeting are before you. Is there a motion?
So moved. Second.
Thank you very much for the motion and second. Any discussion? Will the clerk please call the roll?
Reinhardt.
Aye.
Fretham.
Aye.
Maris Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega. Carter.
Aye. Thank you very much. The minutes are passed, and I will call on County Manager O'Connor for our COVID update.
Thank you, Madam Chair and members. I'll turn it directly over to the Public Health team to kick off the update today.
Good morning, Madam Chair, County Board, County Manager. I am delighted to be here today and give you a brief update on the numbers for COVID-19. My colleague is going to go ahead and start us off by taking a quick look at the CDC's data tracker. We've been following this pretty closely over the past 7 weeks. As you can see, if you scroll a little bit further down, let's take a look. Yeah, our 7-day moving average. At this time, we're seeing 153 cases per 100,000 in Ramsey County. That's high. It's certainly substantial transmission. It's likely due to, again, to the Delta variant. What's interesting about this is that we're starting to see those numbers, as I've mentioned previously, certainly plateauing at this time, which is good news for us. The same actually is true if you take a look a little bit more broadly at other areas, 7-county metro. We're starting to see a little bit of a decline in terms of our case rate. Now, if you would go ahead and take a look at the COVID-19 situation update. Thank you so much. Again, this is another way of looking at the data a little bit more locally. You can actually see, if we go ahead and scroll down, at this time, we've collected enough data over the past 18 months. You can really see the concurrent waves of COVID-19 that we've had, over the past 18 months, about 4 waves here. And again, August, September, a little bit of a decline currently happening, but I don't want us to slow down in terms of our mitigation measures. Certainly with the start of school, we have a lot coming at us. If we could go ahead and take a peek at the vaccine dashboard. This is the last dashboard that I will share with you this morning. You will see slight improvements in terms of vaccine uptick. At this point, at least 75% of our residents have received 1 or more doses here in Ramsey County. If you would go ahead and scroll down. Let's take a look at where we have been over the past 7 days. You will see that our colleagues here in public health have administered a little bit under 250 doses over the past week. We spent quite a bit of our effort coordinating health education with our partners at the State Fair over the past 12 days. I was aware, I think yesterday I got an update from a colleague at the fair. They had given a little bit more than 2,500 vaccines there in the 12 days of the fair, so that was a good effort. Over the coming week, we intend to administer about 350 doses. I do want to take a minute just to look at those 2 bullet points just below the summary, you'll see that we've given a little bit more than 60,000 doses, and we have 61,000 doses on hand. What that tells me is that our immunization program is doing great work in terms of avoiding wasted doses. So I do want to go ahead and give them a shout out for that work, which I think has been an incredible effort and somewhat unusual in terms of other jurisdictions across Minnesota, other jurisdictions across the U.S. We are actively avoiding wasting doses and using our vaccine before it expires. Just a quick update, this information is not yet on the dashboard, and we're talking through how we can provide it in the future. If you were curious about breakthrough cases, statewide we are far under 0.05% at this time in Minnesota, and that same number is true in Ramsey County. 0.045% of cases are considered breakthrough. That's when someone tests positive at least 14 days after their second dose of vaccine. So minimal breakthrough cases, despite what you've heard in the news. With that, I will go ahead and pass the mic to my colleague, Lynn Ogawa.
Madam Chair, Commissioners, County Manager, it is nice to be back after a long holiday. There's been a great deal of information about variants, and so I thought maybe we would talk a little bit about variants today, or that I would talk a little bit about variants today. There are 3 main ways that variants are described and monitored and watched. First is a variant of interest. I'm going to go and I have it written down because it's important. A variant of interest is specifically a variant that has genetic markers or genetic changes that may be associated with reduced ability to test, reduced effectiveness of antibodies created either naturally or by vaccine, or reduced effect of treatment that we give. So a variant of interest is sort of that lowest level of variant that we're concerned about, though, because there are genetic changes on it that may make it more difficult to treat, more infectious, more severe. Right now, the CDC has classified 3 variants, Eta, Iota, and Kappa, as variants of interest. Mu, which is the one that is getting the most press right now, has been classified a variant of interest by the World Health Organization. So Mu was identified in Colombia in January of 2021. It was definitely the cause of their surge, so similar to our numbers on the rise, of Colombia's surge between April and June. They had over 700 deaths during that time, and 2/3 of them were attributed to this variant, Mu. In the past week in Colombia, there's been over 14,000 cases and 530 deaths, and Mu is at least about 40% of all of their caseloads. So the World Health Organization is focusing on Mu as a variant of interest. The CDC has not yet reached that level of interest because it still accounts for less than 0.2% of our cases, and most of those cases came in via travel. Then there's a variant of concern. And so a variant of concern is in which there is actual evidence that there is an increase in transmissibility, more severe disease, or a significant reduction in neutralization by antibodies either produced by a natural infection or vaccine. So Delta is a variant of concern in the United States, along with Alpha, Beta, and Gamma. Lastly, there's a variant of high consequence. The reason that we are not hearing about variants of high consequence yet is there are none identified. These are variants that have been shown to actually evade the prevention measures that we have in place, either medical prevention, like vaccine, or other mitigation. So we have yet to identify, which is very good news, a variant of high consequence. I'm going to shift now a little bit, and I have to share, I watched the Disney Channel Loki, and he's a variant, and if anybody's watched, so as I was doing the research on this, all I kept imagining was all of the variants that Loki existed in. So I'm going to shift a little bit and talk about testing. There are a lot of tests now available. They are not all equal. They are not all the same. They all have good uses and they all have good information. So the fastest testing that exists and the ones that can be at home are often called an antigen test, or they're an antigen test. So they're the ones that actually, you take a swab, you put it under in a thing, you drop some liquid on it, and you get either a positive or a negative. The problem with the antigen tests in whole is that they have, while they have very high specificity, so if you get a positive, it is very likely a positive, unfortunately, they have lower sensitivity. And in fact, there was a study done in Arizona that showed for symptomatic individuals, an antigen test is about 67%. It correlates. And for asymptomatic, it can be as low as 36%. And so it's not the ideal test for asymptomatic screening, the antigen. However, in situations like nursing homes, correctional facilities, or things like that, where you have the same cohort of people being tested over and over again, it's actually a reasonable test because you're testing the same person repeatedly. And so it has a higher sensitivity in those settings as well. The gold standard, the tests that we recommend most, are the PCR or the NAAT tests. These actually increase, they amplify the proteins or the genetic material of the virus. And so they have very high sensitivity, very high specificity. The test that we're seeing most often now as a PCR or a NAT also has a form that can be read within 20 to 30 minutes. So I'm trying to avoid using rapid and not rapid, but really sticking to the science behind the test, because the antigen test is not as sensitive, but it's rapid. These new PCR tests, though, are also rapid and actually have a much higher specificity and sensitivity. So our schools have been, the MDH has offered Q testing, which is a rapid NAT test, and most of our schools are looking into that. We are still serving as technical advisors to all of them about what their options might be and giving them our opinion on that. The Binax now specifically is the antigen test. That's also the one that there's reduced opportunities to find them right now. But again, they are really best for those who are symptomatic. I'm going to turn over now to Director Holly. She's going to talk a little bit more about testing and some other things, and appreciate your time.
Thank you.
Good morning, Chair Carter, County Manager, Commissioners. It's great to be back here. Thank you, Dr. Ogawa, for that lesson variant. We so appreciate it. Just really quickly this morning, just opening up on a national level, the United States has administered a third dose of either Pfizer or Moderna COVID-19 vaccines to over 1 million people since August 13th, when regulators authorized an additional shot for immunocompromised people. And I'll just mention that the CDC is recommending a third dose at least 28 days after the second dose of either Pfizer or Moderna vaccines for people who have moderate to severe compromised immune systems, or who are likely to have weaker protection from the two-dose regimen. Currently, our public health department is not providing those third doses. We recommend that people seek and see their healthcare providers for that dose, but we are recommending it for people that are immunocompromised. As of last week, I think we shared this in our COVID-19 update to the board. Tim Walz, or Governor Walz, announced that the YMCA of North has a series of free COVID-19 vaccine clinics at various locations across the greater Twin Cities. And this focus is really on children who are 12 plus and families who are encouraged to get vaccinated for this school year. And I think this is really important for our children that are going back to school either today or tomorrow, or who have already actually started school. Really important thing to note is that childcare is provided at these sites. So really trying to open up access to families, parents, and caregivers. As of last week, Ramsey County, our vaccine initiative, incentive initiative, reached over 1,184 residents with gift cards. So that's around $59,200 that we've spent thus far. And we'll continue this initiative through September 16th or while supplies last. So if you're listening this morning, go out and get your vaccine at one of our vaccine sites. I just want to give a kudos to our MRC volunteers who have given over 11,158 hours of their time during our response. And so if you'd like to join me in celebrating their efforts, please mark your calendar for September 23rd. And Laura can share more information about that with the board later on. All right, so testing, as Dr. Ogawa mentioned, the state continues to announce more semi-permanent COVID-19 testing sites, with Minneapolis and Lino Lakes opening as of last week, which that is great information. Again, you can find more information on the state's COVID-19 testing site for those semi-permanent testing sites. I just want to mention that it's really important, and I think this point was brought up a few times, that our counterparts at MDH have reassured us that the state, they're doing a lot of more testing, of course, with the semi-permanent testing sites, but we have one of the most comprehensive testing plans in the nation. So that's really reassuring. As mentioned, Dr. Ogawa talked about the varying testing options with the ones that are really kind of most effective, which she's talked about this morning. I want to dive right into conversation around, weekly vaccine. One of the things that I know we're encouraging is that all students within St. Paul and Ramsey County continue to seek vaccine. We still have our school sites, which are Harding and Washington Tech. Wanting to talk a little bit about masking in all schools. As you know, all of our school districts in Ramsey County are mandating masking, so that's excellent as our children return back to school. I just want to mention a few things around partnerships. And so, as always, we are working with communications. I want to stress this, on messaging and ways to reach communities about important COVID-19 updates, vaccine information, and testing. We're also working with the Equity Action Circle Healthcare Committee, which we launched a few weeks ago. And we want to continue in that space working with community about the best ways to get information out to our trusted messengers and also reaching diverse communities. Later this month, and I want to highlight this, Research along with Public Health will launch the very popular Public Health Conversations with Dr. Ogawa, which community loved, right? Yes, I see hand claps. And that will take place, I think, on September 22nd. So we're really happy about that. And that's an opportunity for community to interact with Dr. Ogawa on a more personal level and to get those questions and hot topics answered. Public Health and Research will continue to partner on working to sustain our efforts to reach the most diverse communities in the months ahead. Our trusted messenger model and the connector model has been truly a success, and we've heard from community that they'd really like to see that work continue. So we're really excited about pivoting as much as possible with that. Lastly, Public Health is working with our incident command team to sustain our COVID-19 response. As we know, COVID is not going away anytime soon. So thank you so much. We'll stand for questions.
Madam Chair, I'll just end on the note that schools, as they get kicked off again, it's just going to be a time where we're going to need to be flexible with our employees again. A lot of concern about virus continuing to increase and what that's going to mean for the upcoming school year. And it's going to be a tricky time. So thanks to the entire public health team for the work they're doing. Thanks for working with St. Paul Public Schools on their recent announcement around vaccine requirement in schools. They work closely with Ramsey County around how to model that based on lessons that we had been learning through our work here. And we'll see where it goes, and we'll give updates every week in the meantime. We'll stand for any questions.
Chair Carter?
Yes.
County Manager O'Connor, I want to mention too, to your point, County Manager, that recently, I guess on September 3rd, which was Friday, St. Paul Public School Board approved a resolution that teachers, staff, contractors, and certain visitors be vaccinated against COVID-19 or submit regular testing information. So I think that also will contribute to hopefully lessening the impact of COVID-19 in our St. Paul Public Schools. So I just wanted to mention that point to the board this morning.
Thank you very much
You're
for
welcome.
the ongoing information about COVID-19 in our community. I'll open up for questions from board members. Commissioner Frethem?
Yeah, can you speak more to the testing piece in schools? We've heard that you're providing guidance, but schools are opening up now.
Yes.
And I know the guidance last spring was testing every 2 weeks for families with children in in-person schools. I want to know if that's changed and how close we are to getting plans with the schools. There was a study from a CDC-funded lab, an article about it in the Washington Post that indicated that even with universal masking, if there wasn't a frequent testing, we could expect to see half of our children in elementary schools getting infected with COVID within 3 months. So it seems like sooner rather than later, we want to cut that down to the 22%
Yes.
when you combine universal masking with frequent testing.
For sure. So the recommendation was every 2 weeks. I think we're moving more in the direction of weekly testing. And so, as I mentioned, the state has a comprehensive testing plan, I think the best probably in the nation. And so the options that I think we laid out even last week, that having those semi-permanent, testing sites for families increases accessibility to testing. And so I think, Chair Carter, you also had a question around the provisions, right? And so I think those options that were laid out last week and making sure that our children, our families have access to regular testing, but also making sure that we're working with the school districts and the Minnesota Department of Education and Department of Health to ensure that we continue to reevaluate the access that our children and our families have to weekly testing. Dr. Ogawa, do you have a comment too?
Thank you for that ongoing evaluation. It's very important. Thank you, Dr.
Chair Carter, Chair Carter, Commissioner Firtham, the other thing that I think is especially important, just as Director Holly mentioned, is the higher we get our vaccination rate and the lower we drive community transmission, the better. And so, again, testing exceptionally important for those who cannot be vaccinated, vaccination for those who can be vaccinated, and then other mitigation to reduce spread in the community is still important. And so it's a multi-pronged attack and definitely needed, but in many ways, in younger individuals and we just don't know if people are infected unless they're tested. And Delta does grow faster, and so we think that weekly is probably a much better recommendation now.
And do we have any idea when schools are going to be issuing their testing plans and arrangements? I'm a parent. I haven't received any information from my school about this. And, we're already planning to do weekly testing, but I know I may be a little bit better informed than most parents because most of us don't get to sit down with the Director of Public Health and every week. And I want to make sure every child and family has the access and knowledge to be doing this. And we've heard about the offerings to schools, but I haven't heard anything about what schools are actually doing.
Yeah. Commissioner Firtham, I think the reality is that each of the districts is weighing their populations and their options carefully, as well as actually rollout and how it would work. As local public health and as the state, we're still trying to make as many options available outside of the district itself for testing. And so we are continuing to try and increase the number of sites that people can get to. Often a whole family will need to be tested with children at different levels, different ages, maybe one at a middle school, one at a high school, and so I think that schools are also waiting to see where they can best serve as many individuals as possible. But as soon as we know plans to, we'll make sure that we're bringing them back.
Have we considered drafting just interim guidance, directing folks to places like Roy Wilkins now that it's open, something that schools could just send out in their newsletter as they continue to develop their plans to say, there's free testing here, just walk in, free parking? so folks know that this is available, because I've known people who have like gone to get tests and not realized free testing's available and spent $200 on a test. And I think that could deter a lot of families from doing weekly testing if they don't recognize that there's free testing available.
For sure. Chair Carter, Commissioner Fretham, great question. William Moore, our school health director, during this time responds, is in weekly communication with the school districts. It's very important, especially with the mask rollout, and now it looks like St. Paul with the employee vaccine program. And so I think we'll stay in constant communication with the school districts and continue to provide that guidance. I think one thing to just stress is that these more sites, the semi-permanent sites that open up for our families to access, is so important here. And I think that was the biggest barrier a few weeks ago, not knowing how people could access testing. And so we want to continue to encourage that. And I think we can continue to explore statements and recommendations coming from Ramsey County, but we'll also lean on our state partners to also provide that information. And I think early on, the Minnesota Department of Education did that very well. So kudos to them on that guidance around masking and how to mitigate, put mitigation efforts in place for our schools. So yes, we'll check back in with William Moore to see what conversations are coming up, and then we'll get back to you all on kind of that plan moving forward. Thank you.
I really appreciate that line of questioning, and would simply add on that the schools did receive, I understand, testing resources early on during COVID. Of course, those have likely expired and are no longer useful. The kids were out. Now the kids are back, and I continue to wonder what those testing plans will be, whether they will continue to receive test kits, because it does seem as though the most likely place where kids are going to get access to those tests, regardless of what age they are or what grade they're in, would be in the schools. So as much as we do in the community, the kids are there in the schools, and I would want to continue to hear about those plans that the school districts will have for that more accessible testing, and thank you. Commissioner Reinhardt?
Thank you, Madam Chair, and I think that is something that is really critical, because saying this is what you need to do and then is not really enough. It has to be, and where can you do it, how can you do it to make it work for you and to understand the importance of it. And I guess my first question is about the demographics. When we talk about the fact that we are plateauing right now with new infections, plateauing at a high level is still obviously very concerning. But my understanding is that there are much younger people that are contracting the Delta variant. And so I'm wondering what the demographics are age-wise and other factors, and also the number of the percentage that are getting it that are unvaccinated. So it's kind of just the general demographics of what is happening with that high number.
Chair Carter, Commissioner Reinhardt, happy to answer that question. So currently, the vast majority of individuals, like 95% of those who are getting sick with COVID, are also individuals who are not yet vaccinated. And we are not seeing significant increases of pediatric cases. We're not seeing cases among those 5 to 11 at this time. We do know from other school districts nationwide have seen increases among their peds population, and that's one of the reasons we're working so closely with our schools to make sure that doesn't happen here. I think having universal masking and requiring vaccine for students and staff associated with those populations is a good step in that direction.
And as a follow-up to that, so once school opens, and again, some are already in school, but if there is, if it becomes a super spreader, and even actually it relates to the state fair as well, how long after something big happens would we need to worry the most about a spike? How's that?
Chair Carter, Commissioner Reinhardt, medically and clinically, I would say a week right now, given that Delta replicates faster. But as a clinician, that's not the real world. And we have multiple things coming into play at the same time. So I won't stop holding my breath for about 3 to 4 weeks. Because if we had individuals exposed in the past week and people go back and kids go back to school, the time lag will be 2 weeks. So again, we as public health never stop holding our breath in reality, but my biggest concern right now, and probably our biggest concern, is to watch what happens over the next 4 weeks. Not to be negative, but that's what they bring me into as well. You'll notice when Incident Commander Anderson showed you those surges, right? We are also entering a potentially natural surge time as well. And so we are still concerned about overlapping surges too. So I can't stress enough, though, what our job in public health is to mitigate that surge, is to flatten that curve with the ways that we know to do that. Vaccination, masking, reducing community spread as well, and monitoring. Yeah.
And then the other part of this then is, you talked about the antigen testing, and I think one of the important parts about that is that the reason to take that is to, if you are taking it as asymptomatic, is the fact that I was surprised, actually, a good friend of mine recently when I was talking to her didn't realize that if you're asymptomatic, you can pass it on to someone else and not even realize it, where they got it from. They really thought after all this time that it had to be person to person. I've got it and I'm giving it to you. And so it was kind of interesting to hear that and go, wow, how, because there's so much information out there and so much misinformation out there that it gets really confusing for people that actually are trying to pay attention to it. But to me, the antigen test is not really for the person taking the test. It's so that they don't spread it to someone else. And I know that I had one, and the advice that was given to me, and I absolutely would have followed up on it, or I did follow up on it, I guess. And that was, you can have the test, but if you continue to have symptoms, you should go immediately to the next day, you should go and have the PCR. And I didn't have symptoms the next day, and so I didn't have to follow up. But I do have some antigen tests now because my grandchildren are going into school, and I want to make sure that if there's something that's more instant, at least I've got some reassurance, and then I can follow up on that. And to me, again, that's not about whether or not I'm sick as much as spreading it to someone else, and especially to kids. That just scares the heck out of me. So I think it's really important that people understand why this is a really big deal, especially with the regular flu season coming on, all these things. I mean, one of the reasons we didn't have an issue last year, as much of an issue with the regular flu, was because we were masking and we were staying 6 feet apart. We were doing all the things that we needed to do. So I'm hoping that people understand just how important, first of all, the vaccination is, but also testing because of the people that can't be tested or that can't get the vaccine at this point. I have one other question, and that is about the third dose and those that are immune compromised. I guess, are people being, how do they know if they qualify for the third dose? I mean, I assume it doesn't have anything to do with just age, but what else? So the people, unless they're notified and saying, hey, you know what, you should get a third dose, and maybe that's what's happening, or how would they know?
Yeah, Chair Carter, Commissioner Reinhardt, currently the only individuals who are recommended to get that third dose are those who would have otherwise been not have an adequate response to the first 2 doses. And so those are individuals who have had solid organ transplant, who have untreated or uncontrolled HIV, have known underlying primary immune deficiency syndromes and all of these folks would likely be under or should be under the care of a healthcare provider. Also, those actively undergoing treatment for cancer. So it's a small percentage of individuals. And in fact, the CDC had said it's only about 2%, should only be about 2% of individuals right now, adults, period. We, again, we as public health are relying on healthcare for that, to both identify that population and give them that third dose as well. And so it is a conversation that should be happening in primary offices of those who are highly immune compromised. Yeah.
Thank you. Thank you for all the great work that is being done. Providing information is probably the most important weapon we have in fighting this. Thank you.
Thank you. Commissioner McGuire?
Thank you, Madam Chair, and thanks to all of you for all of your work. I want to tag along on some of the questions that Commissioner Reinhardt was asking, and mine are on the asymptomatic consequences and spreading to children. So we've all been hearing lots of news reports, and they say, well, kids are getting it from adults who maybe don't know that, most of them who don't know that they have it. And I just want to affirm what I think is that these are adults that haven't been vaccinated. And so because adults who have been vaccinated shouldn't be asymptomatic, shouldn't be spreading it, because we don't hold that virus in us. So just if you would affirm that's why we need adults to be vaccinated, is because we aren't going to spread it to the kids, even asymptomatically. And I think we've been saying that over and over, but I just think we can't say it enough, that's why we need everyone to be vaccinated.
Chair Carter, Commissioner McGuire, I wish that I could be super black and white about this. I can't, and we can't within the scientific data and literature. There was a paper published about a week and a half ago now, or actually it might have been even unpublished, but made the news, that does show that vaccinated individuals can carry or have the virus in their nasopharynx. So it's true, in the beginning, we really felt that vaccines were able to prevent spread, not just prevent hospitalization, not just prevent death, but we felt that there was good data to support at that time that they could prevent spread. Unfortunately, that was also when community spread was low. And so there were some assumptions made that the vaccine could prevent transmission. Now, we know that it's still very good at preventing transmission. Not the 95 to 99%, more like the 90%, but potentially even lower than that a little bit to prevent spread, which is why we're all wearing masks again, regardless of our status. That's to lower that mitigation or lower that transmission even more. We do know that people who've been vaccinated, though, clear it much faster as well. That was part of the study as well. Didn't make the news as much because it didn't garner as much attention. But we also know that while somebody who is unvaccinated would get sick and would probably carry that virus in their oropharynx and their nasopharynx for 14 days, right? That's the whole isolation time. A person who's vaccinated probably carries it for more like 3 to 5 days. So it shortens that. So it shortens the time that you can transmit it, but it doesn't eliminate the ability to transmit. So it is difficult. It's also new information. Again, I really do enjoy the building the plane as we fly it comment, because that is what's happening. This is science in many ways on the fly. And so 90% prevention still way better than 0. And we also know that most of the cases, transmission illness, all of those are still coming from individuals who are unvaccinated. And vaccination reduces level of transmission, hospitalization, and death. So that's where it gets a little gray.
No,
Yeah.
but I appreciate that, and that reminder, of course, of the importance of wearing masks, because I know a lot of places are saying, whether or not you've been vaccinated, wear your mask, and I think we agree with that, of course, in Ramsey County here, that is really important. So thank you. No, thank you for that. I appreciate it. Just a couple of other questions. You had mentioned the variants of concern were Delta and Alpha, Beta, and Gamma. And I don't know if we want to get so into it all, but basically we don't see much of the other three. So that's why, we're just continue to do all these things that we're doing, because so we don't see the other three. So.
Chair Carter, Commissioner McGuire, currently, Delta is probably greater than 99% of the cases that we're seeing. And so the others have been shown to sort of peak and then drop off. And so, yeah.
Okay, thank you for that. And then just a couple more. The state fair, as we know, and I was disappointed that the buildings didn't require masks and that there were so many people without masks. I actually did go, and I was wearing a mask almost the entire time, except for when I was eating. And I do worry about what we might see. But so who will those numbers get reported to? Everyone's going to go back to their home counties, and they'll see their doctors and they'll have symptoms. So does that all get reported to the state? So it'll all come through the state, and they'll realize maybe that they went to the state fair. Can you just explain how that's going to happen, how we're going to know about this?
Chair Carter, Commissioner McGuire, it's essentially the same contact investigation, contact tracing that we've been doing throughout the pandemic and that the state's been doing will occur again. This is also sort of that lag in data that we talk about, in that what will happen is as they return to where they are, cases occur or outbreaks occur, then contact investigators and contact tracers will be talking with them and trying to find out where that exposure occurred, and then ultimately we'll be able to break down the data if it can be traced back to the state fair.
Thank you for that. And then my last question is, and I'm so excited that you're continuing on with our community conversations. Is that going to be on Zoom or in person? I think you might have said it, but I missed it. But just to confirm,
Chair Carter.
because I know those are really popular, and I listen to them as often as I can, and I thank you for that.
They are. Chair Carter, Commissioner McGuire, they'll be on Zoom, and they'll be from 4 to 5. And so again, we really want to get to the hot topics, and we also ask community what they want to talk with Dr. Ogawa about. So it's exciting. We thought it would be great to bring that back. I also just want to mention a few things before we wrap up, is that we are refreshing and relaunching the Research Mask for Everyone initiative. And so we're encouraging our school-age children, parents, and families to reach out to St. Paul Ramsey County Public Health for free masks, and we're doing that in partnership with our schools, of course. And we've heard from our school partners that, of course, they will also provide masks, just like they did towards the end of the school year last year. A couple of things that I do want to just mention to kind of follow up Chair Carter and commissioners with comments that were made earlier is that, public health will be available for that outbreak testing should we need that in that partnership with our schools. But we're really going to be looking to our schools to use their ARPA dollars to resource testing. And so I want to just stress that point. I think there may be an opportunity. I think the state is also looking at extending a contract with Minnesota Community Care to support testing with our diverse residents here in St. Paul, but I guess even across the state, because they're an excellent resource, one of our great FQHCs here in Ramsey County. And then, along with this conversation around vaccines, I want to encourage, if you're listening this morning, to make sure that we have our children caught up with their well child visits and other important immunizations and vaccines. So we want to stress that. I know the state has a big campaign going to get people vaccinated, not only just for COVID, but to stay up to date. As you know, COVID had a significant impact on people accessing care and going to their primary care doctor. So I want to stress that. And just another point of reference, if you're sick, if you don't feel well, stay home, right? Wear your masks. Again, get tested on a weekly basis. If you travel, if you're in congregate settings, if you happen to go to the state fair and you feel a little, leery about your status, know your status. And so again, those mitigation efforts, wearing a mask, regular testing, making sure you go out and get your COVID vaccine, and if you're eligible for a third dose, seriously consider that and have that conversation with your healthcare provider. Thank you.
Thank you very much for the reminders, the good public health actions that we should all be taking. And again, for all of the work that you're doing, your mention of the schools and testing, and certainly we would look to them to take advantage of resources that they are receiving to keep us healthy and to help us in recovering through the ARPA. And I really appreciate that you all are looking out, having those regular conversations and being in contact with the schools about their plans. It's important to all of us. And I so look forward to conversations with Dr. Ogawa, resuming. Okay. Before we move on, I also want to just underscore that in our leadership role as county commissioners, we have been very careful to act wisely with respect to the COVID in our community, and even as we came back with flexibility to begin additional mediation steps. We see ourselves in mask. That was a surprise as we saw the coming variant. We see ourselves also working to ensure that throughout Ramsey County we have good policies and practices for COVID mitigation, including our mask mandate, also including a requirement for vaccinations and or testing, and the number of recommendations for social distancing, et cetera. So now as we are approaching, or as we have seen the Delta surge, and we are continuing to make changes within our community, you should know that we've been having conversations with public health assistants about additional mitigations and changes that can happen within our community to provide that good leadership step by step as we observe the data and information about changes in the COVID realities that we are seeing. County Manager O'Connor and I have talked about the board's work, our board meetings, our committee meetings, our budget meetings coming up, our workshops in the afternoon, and are considering, and we'll continue to talk with board members this week about changes we may make, again with flexibility to ensure that we are modeling and taking the best actions we can. I would ask County Manager O'Connor to share thoughts about changes in Ramsey County, and also anything you would want to share about our conversations as we think about those upcoming meetings and discuss with board members changes we may make.
Thanks, Madam Chair, Commissioners. I won't add anything to the conversation with the board. I think you framed that part well, and where you could position yourself or how to think about where to be in an uncertain time. It's all frustrating. I'll just lead with that. Backtracking is frustrating across the board, and I'm frustrated, and I know I'm not alone in that, so I just feel a need to say that out loud. I want to thank Public Health, Property Management, and Human Resources. They've been working together on a plan around where we need to think about taking steps back and where we need to be thoughtful. We're going to have a return to occupancy limits that we had earlier this year. We're reinstalling some of the signage you might see on meeting rooms and conference rooms around the county that we had been happy to be able to leave behind for a little while. The limit of 30 people in the chambers is going to come back. We've already tried to remove people who are not here for specific need on those days, so the virtual piece remains a part of it. Limiting the amount of in-person presenters is a part of that. Meetings, trainings, interviews done virtually when possible. A lot of those things work well, I would add, actually. Like, those are the things that work better. The continued social distancing and being outdoors when possible, and then public or outside organizations continuing to not be able to access our meeting rooms, which is tough, and we want to get past that at some point, but we're just not there. We're also sending out a message. We're at the end of it, going out to the senior management team after working with the county attorney's office and everybody else around guidance for all of our advisory committees, commissions, boards, and the public meeting open law, and where does that stand, and what are the options in front of us. And it's one of those things where right now, depending upon the group and the nature of their function, they're going to have to make some level of decision about what is appropriate for them, but there is an encouragement from public health to move back toward a more virtual setting for the time being. And we want to be consistent across our groups as that goes out. And so that guidance is going to go out, I think, today. We'll see if I can get my eyes on the final edits between things. it'll be out this week for sure, and I'll share that with commissioners as you think about your work. The one thing through all of it, I guess I would just add, is the board uniquely does some of its work in person in a way that is even unique among groups in terms of how that sometimes fits. And so as you're working through both balancing the side of conducting business with the risks and leadership role you all want to play, we will work with you to do that. And there isn't one clear-cut answer, but there are pieces of guidance that we're sharing to try and make it as clear as possible as you all think about your next week and beyond.
Thank you. So I just wanted to put that out as we continue to talk this week about our plans upcoming and find out if there are commissioners that have comments, Commissioner Reinhardt, and any others.
Thank you, Madam Chair. I think that it's important, I mean, we've talked about COVID fatigue and going back and forth so often. It seems like it's become part of our daily, well, it is part of our daily life, but the fatigue part of it, where you're just like, do I really have to do this again? And, you know, and it's amazing how quickly we adjust to not having to wear masks. And then once you start, you go, okay, now I need to wear a mask again. It doesn't take that long to get used to that either. And so I think it's important for the public to know that we're feeling the same way.
Absolutely.
And that we're trying to make the best decisions that we can based on the incredible staff that we have here that provides us with that information and how we need to move forward. And so we are making informed decisions, but it doesn't mean that we're not tired as well and wishing that we just weren't in this spot. And when you look at the fact that 90-some%, I think it was 95% are people that were unvaccinated that have now been part of this surge, I mean, these are individuals and families, and it's just sad to see that happening. And of course, it means it spreads to other people that, you know, maybe are vaccinated, but they don't have as much of a it's not as lethal to them. But I think that that's important. And I also think that this just leads me to the last thing, and that was, you know, what Commissioner Fretham was talking about as far as testing. For our employees as well, I mean, we need to have something in place because right now I couldn't tell you, I'm sure Commissioner Fretham could, where the testing can be done for free, but I don't know because I haven't had to do that. And I think once we get more people coming back in, hopefully we get through this and we can feel more comfortable trying to pull back again, but we will see what happens. But I think that we do need to provide more information on where testing, it doesn't have to be us, but on where people can get tested.
Thank you. And I know that we do have that information on our website. It's difficult to get it out in as obvious ways as it needs to happen. But in working with our partners also, we continue to share that information. And I know our public health staff here will take it under advisement and continue to build forward those ways to make it obvious and clear. I believe, Commissioner McDonough, you had some comments as well.
Yep. Thanks, Madam Chair, and I thank you for bringing this up here as we wind down on the update. I just wanted to share a couple comments, and I know you indicated you'll be checking in with us, but take this time to, you know, I'm angry, you know, that we even have to be doing this, right? When the data is so strong that a vaccination has that big an impact on our community and the well-being of our community and the greater good of our community, right? I mean, this country has demonstrated time after time after time in our history that we have to step up for a greater good. It's not always what we want, but there's a greater good. And I think we're failing in some ways this time, or at least there are individuals in our community that are failing us as a whole in this community at this point in time, which makes us put our mask back on, which makes us continue to have these conversations we don't. Impacts our children as they're trying to get, you know, prepared for their education. And, you know, just a couple of quick comments, because I do think, you know, I evolved in my thinking as I learned from our staff. You know, I was one of the ones early on that felt we need to get back in this room. We need to demonstrate that we can. But then I also learned how much we model, you used the word modeling, you know, how people look to us as leaders in our community. and walking the talk. How can we tell our advisory committees, you should meet remotely, but then every Tuesday we come into this room? I look around this room and I get worried because it starts to fill up, and I start thinking, okay, this is important. People need to be here. They want to see us doing what we're doing. But now we're to the spot where we say, no, you can't come through those doors and watch us. So what's the best way to have that access to us as we conduct the public's business? And I think there's a point where meeting in person has a lot of value, but we start actually losing the ability for the public and their staff and people that care, and the ability for them to have access to watch us actually do the work that we're elected to do. And so I appreciate that. I do think there's, a sense of timeliness to this too. We're going to have to make some decisions that we're going to be pushed into probably quicker than we want. Just again, because we are looked to as leaders, and we are looked to of how we model what we're doing and how we walk the talk. We say all these things, we give suggestions, we're strong about this is what you need to do. But then I want to look back and make sure that I'm walking the talk, that this board that I'm a part of and helping make decisions is walking the talk at the same time. Thank you, Madam Chair.
Got it. Thank you. So I appreciate the comments that board members, Commissioner Fretham.
And I just want to add to that, Commissioner McDonough, that's one of my fears with school starting. If there is a 1 in 3 chance in the next 3 months, my daughter will get COVID because she's too young for vaccination and going back to school full time. That means there's a 1 in 3 chance I'm going to be exposed to COVID. And even though I'm vaccinated, I could still be infected. I could still spread it to all of you. And I am concerned for everyone else's safety and the risks that I am taking in being in this room. And I want to be able to do my job and do it safely and well, but every link of exposure, and I don't see a way around it other than keeping my daughter out of kindergarten for a year, which doesn't seem in the best interest for her.
So we see playing out in this very room the concerns that our community members are dealing with every day as we endure through COVID to make the very best decisions that we can based on the information in front of us. Thank you for sharing. Thank you all for your comments as we work through this week to make our determinations to best actions we can take together. I do want to note, of course, that we continue to be available through our broadcast, through Zoom for participation in our meetings. And so we want to be sure that as we make any changes, we carry those capacities together with us, and we will. Thanks for great discussion here, as is typical. If you have no further comments, County Manager, before we round up the COVID update.
The final comment, Madam Chair, is with the Thursday budget meeting, as conversations occur within the next 24 hours, we're prepared to make a shift as of Thursday. I want to give credit to the Health and Wellness team and the budget folks for being ready to do that, and we could move back as soon as that. So the mention of things coming faster than they may need to, I would just flag that that's a day. It's also our largest service team. It's the most challenging actually to plan in person right now. We've been really trying to think through logistics. So as you go through your day today and into tomorrow, just know that we've been doing our prep work for that, and I want to thank staff for doing that.
Excellent, and thank you very, very much for the preparation. And so we will wind down our COVID update with our moment of meditation, beginning now and concluding shortly. Thank you. Please let that brief moment be a reminder to all of us and to anyone to continue to take those moments to breathe and to be healthy and well in our bodies and in our spirits. As we move on, then we have Commissioner Reinhardt, who will take us through the administrative items. Commissioner?
Thank you, Madam Chair.
I'd like to move item number 3, which is the terms of collective bargaining agreement with the Law Enforcement Labor Services, number 349, Emergency Communications Center, dispatchers, telecommunicators for the year 2021. I'd like to pull item number 4, which is the renewal of active employee and early retiree medical insurance contract with Health Partners for 2022. I'd like to move item number 5, renewal of employee, retiree, dental, and employee life and disability insurance plans for 2022. I'd like to move number 6,
Pull.
which is grant award from the Minnesota Housing Association for Family Homelessness Prevention and Assistance Program. Number 7 is site agreement and service fee addendum with Serve Minnesota to host and support housing resource members.
I'll pull that one along with number 6.
Number 6 and number 7?
Yes.
Okay. Number 8 is I'd move the master contract and network communications international corporation doing business as NCIC inmate communications for video visitation services.
I'll pull that as well.
Okay. Number 9 is the grant application to the Department of Employment and Economic Development for transportation and economic development infrastructure funding for the Rice Street Revitalization Project.
I'd like to pull that one.
Exciting one. Number 10 is the 7th Amendment to the office lease agreement with Spruce Tree Center LLP. And number 11 is the name change of the Intellectual and Development Disabilities Committee to Disability Support and Services Committee. Number 12 is the appointments to Board of Directors for Minnesota Landmarks. Number 13 is the cancellation of board meetings in the fourth quarter of 2021, which would mean canceling the meetings on December 7th and December 28th. Number 14 is I would move the approval of July 2021 report of contracts, grant and revenue agreements, emergency purchases, sole source, single source purchases, and final payments.
Thank you. Thank you very much for the motion and second on those items not pulled. I will note that we pulled number 4, number 6, 7, 8, and 9. So the motion is on other items, 3 through 14, that have not been pulled. We have a motion and a second. Is there any discussion on those items we're moving forward? Fantastic. Please call the roll.
Reinhardt.
Aye.
Freda.
Aye.
Mattis Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega. Carter.
Aye. Thank you very much. Those motions or those requests have passed, and we're going back then to those items pulled, beginning with item number 4.
Madam Chair, I'd like to move the renewal of the employee health and early retiree health insurance.
Second.
Thank you. There's a motion and a second. Commissioner Reinhardt.
Thank you, Madam Chair. I think when we received the notice of this, that we were all kind of wondering, okay, what's really going on here? And so I reached out to our staff, and I believe that both are here, Greg and Sandy?
They
Or
are on Zoom.
On
yes.
Zoom, okay. Better yet, for safety purposes. And they were absolutely amazing in getting the information that I requested. I asked for information about comparison to other entities that were in the metro area, or information that would be relevant to us as far as, are we in the ballpark kind of thing. And I also asked for information about the timeline for this. Was it something that had to be done today? And the answer was yes, in order to be ready for open enrollment. The other thing was about the Labor Management Committee on Insurance and what was happening there and how things were moving. Because I think there was a misperception that we didn't have that Labor Management Committee on Insurance specifically, and how it has worked in the past, and what changes or what didn't happen over the last few years as far as change modifications. And so I would like to call on Greg and Sandy, whichever order they want to go in to kind of overview this information because I found it very helpful, specifically in the area of we have single coverage and we have family coverage, and we don't have anything in between. We didn't make changes, we haven't made changes to the plan itself as far as co-pays and different things like that, I think for 4 years. And prior to that, we had been doing that in the Labor Management Committee on Insurance. And so there's a lot of things that maybe we can look at, and I think our employees would really like us to look at into the future, and that is including some of the comparisons that I received were about narrower plans for people that made sense for them to do that. So there's a lot that's going on here and that I think will be happening within the next, well, hopefully throughout this negotiation process that will go forward. But for today, and I can tell you, I mean, I was a AFSCME local president, and so I'm used to going through this and how important that input is and how important consensus is. But sometimes we need to move forward to make sure that everyone is covered. And that's what we're in today. But I think that where we can go from here, and that's what I think Greg and Sandy can really talk about, and what I was impressed with is how we can make progress, and it'll be good, hopefully it will be good for all involved. And I don't know about you, I guess I'll end with this and then let them speak. I knew how much employees paid, but I really didn't understand the extent of the amount of money that is spent on health insurance. I mean, when you're talking between employee and staff, and employer and employer, you know, several $1,000s a month is pretty, it surprised me. It shouldn't have, but it did. And so I think we've got a lot of good work that's been done, but I think we've got even more coming. And so I will be supporting this today because I want to make sure that we have the coverage that our employees need. And without doing that today, we wouldn't be ready for open enrollment. So it is, I wish we were in a different spot right now, but I think the explanation that I received was really well done, and we need to move forward together.
Well, I want to thank you for the questions that you have asked and from the depth of your experience that you've shared with us, those questions and responses that have been provided, both based on the work that's happened, where we are today, and what needs to happen. And I do note that we have both Sandy and Greg on the screen with us here. I want to, if it's all right with you, County Manager, turn to the two of them to share with us. Commissioner McDonough, did you want to comment before?
Yeah, please.
All right, Commissioner McDonough first, and
Yep.
then we'll go to
Yep.
Greg and Sandy.
Thanks, Madam Chair. Well, I'll share, I was much more than confused. I was a little angry when I got that letter because there's no examples of anybody doing better than our employees on coverage or cost participation, and certainly would look to that. But my understanding, and I'm very involved in AMC and around, our employees do pretty good with coverage and cost participation. Actually very good. And I challenged them to give us some examples where there are other organizations that are doing better by their employees than we. For labor management to work, it's a two-way street. And my understanding is because plus one and narrower bands have been a part of conversations for a long time, it's been the resistance of the unions wanting to move down that path and not the resistance of our folks wanting to provide more flexibility and opportunity into the future. So I just want to make sure as we move forward, I do appreciate, and it's important for consensus and it's important for us, but there is a responsibility on all parties here to work together. And I do think there are times when we do so well by our employees that our employees forget how well that we do by them, and they continue to expect more, not recognizing that we've done pretty good by them time after time after time after time. And that's why I feel like I need to say that, because I was I know all these people that signed that letter, And I was extremely disappointed that they sent that letter to us, knowing the value that they get for the coverage that they get. There's nobody paying $75 a month for individual insurance that's costing almost $2,000 a month. That's a pretty good deal. And if they could show me somebody that's getting a better deal, then maybe we can talk about that letter.
Commissioner, I believe you've probably highlighted some of the things that, in fact, our leadership from Human Resources would share with us. Thank you so much for just illustrating the depth of that concern. We have a lot of work to do. And with that, I will turn to Sandy and Greg, who are on screen with us. Thank you for being here. For any highlights that you might add regarding the work done, where we are, and what we need to do moving forward.
Madam Chair, Commissioner Reinhardt, Commissioner McDonough, and the remainder of the board, thank you for the opportunity to provide some information this morning. I'm going to have Greg share some information that he shared with Commissioner Reinhardt on Friday with regard to comparison, and kind of give you a framework for the information that he provided her, so that there's some even footing here amongst information. I do want to note that I appreciate the compliment that we were absolutely amazing. I will give credit to Greg and to Allison Kelly, who were the two individuals that met and talked with Commissioner Reinhardt. They did so based on my awareness, but I didn't want to take credit for being absolutely amazing when it wasn't me. So I do appreciate that my staff were fantastic. There's several things that have been going on in the last couple of weeks, and I just want to make that clear. Early last week, the board received a letter from certain representatives of our labor groups. I will note that there were several missing from that letter, so it was not a letter that was written on behalf of all of labor. It was a subset of labor. I appreciate Commissioner McDonough's comments about the letter and his reaction to it. But just, really wanting to make sure that everyone understands that that was a portion of our labor contingent, not the entire labor contingent. We had that letter, and then later in the week was followed up by the board packet that has the RBA that's in front of you, as well as a letter that County Manager O'Connor wrote to the Labor Management Committee in light of the recommendation being made to the board today on the RBA. So there's a couple of different documents out there, all related to the same thing, which is where are we and what are we doing with regard to health insurance for our employees. So Greg, if you could just provide sort of context for the comparison information that you provided to Commissioner Reinhardt, so the rest of the board has equal footing with that. I think that might be helpful to us right here. And then I also want to provide an opportunity for County Manager O'Connor to provide any kind of insight that he's got with this as well. He spent 4 years working with the Labor Management Committee, and so has some deep understanding of the activities that go on there. I do want to make clear that the Labor Management Committee on Insurance is in fact in existence. It does operate. We have met regularly throughout this year. The last several meetings that we had over the course of 2 to 3 months, all focused on what we should be looking at for the 2022 insurance renewals, and how do we help offset the continual increase that everyone experiences insurance in health insurance, and that committee has engaged. It's had robust conversation. I think we've actually progressed in our conversation with one another. We did not reach consensus, however, and I think additional conversation and education needs to occur. But that committee is operating. Our ability to reach consensus on how to develop our plan offering has hit a roadblock over the last several years, but not for a lack of trying. I would certainly say that. So I'm going to give Greg a chance to just sort of level the playing field with information at this point.
Thanks, Sandy. Madam Chair, Commissioners, Greg Anderson, Benefits Manager here at Ramsey County. Yeah, I had the opportunity. I've had the opportunity to work with the Labor Management Committee on insurance now for about 7 years, and it does good work. There's valuable things that are discussed at that Labor Management Committee to kind of get everybody on the same page with respect to what's the challenges with regards to health insurance in today's marketplace. And I think one of the things that we as a committee have been having a fair amount of discussion around is consumerism and how we're trying to get people to understand, to Commissioner Reinhardt's point, there is a cost to the insurance that has to be recognized. And as all consumers of that insurance or users of that insurance, we've got to find ways to educate the folks that are using those benefits to how to be smarter about using those benefits and to find ways to keep the costs in a more manageable situation. We are in regular contact with a lot of other public sector entities in the metro area with regards to the insurance products that they're offering. We have had a longstanding relationship with Health Partners. We've had a very good relationship with them. I think that there's been opportunities of late where we've talked about, are there other ways that we can design different plans that might afford those individuals who believe that the cost of the current plan is just beyond their reach. And there are some things that we're trying to put together that will help to manage or better allow more people to participate in the health insurance program. What I was able to provide Commissioner Reinhardt was, again, some summary information from maybe 7 or 8 different municipalities here in the metropolitan area and what their health insurance plan looks like. We also talked a fair amount about what goes on with regards to the questions of labor negotiations in general and how those tie into the insurance cost and whether insurance should be part of the pie, and if it is part of the pie in terms of what we have to work with, how does that get divided so that all parties are of an understanding of how the financials work on this. I think there's just lots of opportunity for us going forward with regards to ideas that we have, and we are approaching the final year of our contract with Health Partners in 2023. We'll be going out to the market for new proposals. I think we'll be going out with a little bit of a different perspective with regards to what we want as an employer providing health insurance for its employees in that next 5-year period. I guess that kind of wraps up, I think, essentially what we talked about. And I appreciate, Commissioner Reinhardt, your comments about the fact that the information that you received was helpful. And if there's more that we can do in terms of educating the board with regards to what we see in the marketplace and what direction we're hoping to take, we'd be happy to provide that information to you.
I want to thank both Greg and Sandy for the information you've shared, and also Allison. But I would also say that all the board members appreciate your initial responses that you sent around to all of us, to Commissioner Reinhardt's questions. And we acknowledge that you had a deeper and amazing conversation. We thank you for that as well, and for bringing forward that additional information today. In summary, Commissioner Reinhardt.
Well, and I just wanted to say, Sandy, you are amazing, but I really, again, the depth of the information that was provided by Greg Anderson and Allison Kelly was really in depth. It provided a lot of context on not only where we are, but probably more importantly, where we need to go next. And that's how come I am hopeful that we need to make changes. And we need to do that through the Labor Management Committee on Insurance. And I think with this discussion and with this, with the new contract going to be, or RFP going to be put out on this, the timing is right to understand just what needs to happen, what needs to take place, because this is an incredible cost to all of us. And so I appreciate that, but I wanted to make sure that I did the shout out to Allison Kelly and Greg Anderson as well.
Thank you. County Manager O'Connor.
Thanks, Madam Chair. Thanks to the HR team for the description. And for everybody who sits around the Labor Management Insurance Committee table, Sandy, I believe you were the one who mentioned I used to sit there as well and spend time at that table. It's tough work. It's complicated work. It's not easy. And you don't make friends as you're thinking about things like copay costs and everything else too. So everyone's got a tough role to play. I did send a letter to the full committee late last week and CC'd the board on it. And it gets to some of what we're talking about here. 4 years ago, when we went to market and looked at various plans, we ended up staying with a pretty similar plan structure to where we've been for a long time. And I think at this point, what we're seeing is like times have moved past a bit of what we decided was still okay to stay at then after doing a pretty deep evaluation. And we've heard some of that from individual employees as well as it's been a tough year and we had a 0% budget and we did 1-year labor agreements, right? There is no dispute to the idea that healthcare costs then eat up what you see in terms of your paycheck. And I think I want to give voice to that here and acknowledge that. But the cost of healthcare in that contract is what it is, regardless of where it gets paid out, and the cost is significant on all sides and all parties, and for the taxpayers who fund the work of Ramsey County, it's significant. And so this balance is important. Some of this work will happen at Labor Management Insurance Committee. Some of it happens through negotiation as well, and those negotiations are ongoing. And ultimately, the plea in the letter that I sent was, we have to find a way to do this together, and now is the time to say, like, we can't not find ways to do it together. Going our own ways might be cathartic for a couple of months, but over the long term, this organization has a history of stable and predictable ways to both support employees and manage costs. And we're going to need to do that as we go forward. And so I appreciate everybody for thinking about the part they can play in that, and I pledge to do the same from where I sit and working with the board here. And sometimes things get harder before they get better, and I think we're at that spot right now to prove that to be true here over the next 12 months. Thank you, Madam Chair.
Thank you very much. We appreciate the discussion of this item. We are on item number 4. There's been a motion and a second to approve the request renewal of active employee and early retiree medical insurance contract with Health Partners for 2022. Is there any additional discussion? If not, will the clerk please call the roll?
Reinhardt,
Aye.
Bretham,
Aye.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega, Carter.
Aye. Thank you very much. That item has passed. And we're going to move on to item number 6 and item number 7. There is a grant award from Minnesota Housing Association for Family Homelessness Prevention and Assistance Program. And item number 7 is a site agreement and service fee addendum with Serve Minnesota to host and support housing resource members. I know that we have the director of our housing stability program here and would ask, or department I should say, and would ask Keith Latimer to come to the front while I request a motion
So
and a
moved,
second
Madam Chair.
on the 2 items.
On both items
Second.
6 and 7.
Thank you. There is a motion, there is a second, and I really appreciate that you're here to just highlight for us these 2 items at this important time, but for the work that we do on behalf of our community, always. Director Lattimore, thank you for being here. Again, on these 2 items, we have the motion and second supporting the 2 of them, and we'll be voting on it shortly. But could you just please highlight to us the importance of these 2? Thank you.
Yes, good morning, Madam Chair, Commissioners, and our County Manager. I actually have Leanne Ahmad. I believe she's on.
She's on Zoom. We see her.
Yep.
There's Leanne. Hello.
She'll be taking.
We have Leanne Ahmad here
She'll be
with us.
taking item
There now
6,
with this
and I'll
setup.
come back to item 7.
Excellent. Thank you for being here with us, Leanne.
Thank you. Would you like an update? Chair Carter?
I'm sorry, we're looking at item number 6, which is the grant award from Minnesota Housing Association for our Family Homelessness Prevention and Assistance Program. And I am just asking you to highlight this work and the grant that we are receiving from Minnesota Housing.
Well, thank you, Chair Carter and Commissioners. Yes, this is a biennium agreement in which we've received for multiple bienniums. It's exciting opportunity to continue to support our partner agencies through the continuum of care with prevention efforts. So preventing individuals from becoming homeless and rapidly rehousing individuals who are at risk of being homeless.
Thank you very much. The amount of the award is $3,962,171. And I would just say this isn't brand new work, but it is important to note the work that we do with organizations across our community to ensure that not only during COVID-19 or beyond, but that we are able to support and keep people from being homeless. And thank you to the organizations that do this work. Commissioner McDonough is our representative, together with other organizations that continue to focus on these areas of work. So thank you for sharing that. And I'll turn back to Director Lattimore then for item number 7, which is the agreement with Serve Minnesota, to just share with us this exciting opportunity.
Yes, again, Madam Chair, Commissioners, County Manager. So item 7, we have worked with Serve Minnesota last year. If you recall, our work with AmeriCorps volunteers was substantially impactful, specifically when we were moving folks from our homeless, encampments into the hotels during our COVID-19 emergency response to the homeless. And these were individuals who partnered with us, who worked tirelessly right beside in our 24-hour hotel operations to move those individuals who were facing homelessness in Ramsey County and work to make sure that they were stable inside the hotels. This year, they're partnering back with us. We want to be able to move forward. I will add that those who worked with us last year, many of them actually came on board and worked for Ramsey County in our limited durations. So we see it as a pathway for them to come to and continue to do this work. This year, they're hoping to do this as well, to partner with us. And as we move from moving people in the hotel, we want to shift that now into moving folks into permanent housing and to use them as navigators to help do that work and also engage public, landlords as well, with some of the landlord work to make sure that we're doing our community engagement with our landlords and that they are, being that party with us, working alongside that work, as well as working in our St. Paul Opportunity Center. That is where we see them. This is an 11th month program, and we're hoping to get 20 individuals to move and help work alongside the Housing Stability Department to do this work.
Thank you, and that is a fantastic opportunity to lift up a relationship and partnership that began in response to COVID-19, but now that helps us to go beyond simply the emergency response to continue to advance or to help people advance toward the permanent housing that they need. I really appreciate all of the work that Housing Stability is doing in that regard, and thank you for being here just to share and highlight it for us. Is there any further discussion on these 2 items?
Good work.
Thank you. All right. So we're going to go ahead and ask then to call the roll, this time on item number 6 and item number 7. Thank you very much, Mee.
Reinhardt,
Aye.
Fretham,
Aye.
Modis Castile,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega, Carter.
Aye. Thank you very much, and that motion has passed. We'll move on then to item number 8. And item number 8 is a master agreement with Network Communications International Corporation, doing business as NCIC Inmate Communications for video visitation services. I have pulled this item.
Do you want a motion and a second?
Yes, and I would like a motion and a second. Thank you. Yeah, I was going to ask for that.
I think it's good teamwork right here. That's good, good work.
Thank you. Did I hear it?
Yeah.
I heard the motion and the second. Thank you. And so I know that we have the Sheriff's Department here with us to highlight this item and also to respond to a couple of questions regarding it. Initially, as we looked at this request coming forward, there was concern about moving this forward today as it reflects on work that came before the board in 2019. This is about communications for our adult detention center residents, and that communication is very important. In 2019, we moved forward a request for board action on a contract for phone calling. At that time, we did so reluctantly as a board because the contract was a revenue sharing contract. And at a point in time when we had done a study regarding fines and fees, we were adamant about reducing those revenue contracts or eliminating those revenue contracts in this environment, and in fact have done a lot of work on fines and fees to reduce the impact to inmates who are in the adult detention center. This agreement then reflects back on that phone calling contract. It is a video conferencing contract, and it does reduce the cost to inmates. However, it continues to present concern because, as in the 2019 phone calling contract, there is revenue sharing here. In a slight amount, I would say that you've drastically reduced those costs. The revenue expected to be generated is only $10,000. I do have a question about why, in fact, if we are reducing it down to that amount, we wouldn't take it all the way down to zero. But the first question is, given we have not yet reflected back on the 2019 contract, which we had asked to do, we want to be sure that you are looking at overall communications in the Ramsey County Adult Detention Center and the focus of eliminating those revenue contracts and getting down to just the cost of providing services for our inmates. Wanting to look at this contract today and move it forward because we do understand the need to make communications easier, even during a time such as this, but also to have this conversation with you to ensure we're looking at overall communications, to ensure that we're looking at eliminating those revenue contracts, getting the costs down to actually what it is for those essential communications. So I will turn to Kyle Meestad, who is on our Zoom call with us and can provide some perspective for us on overall communications as we consider this video conferencing RB or request for board action today. Kyle.
Good morning, Madam Chair and Commissioners. So with respect to phone calling and video visitation in the jail, there are two separate systems. First and foremost, the Adult Detention Center is required to provide phone calling services at a minimum. So that's established by administrative rules. So the phone calling system, that contract was passed in 2019 at a significantly reduced rate. The contract before you relates to video visitation. So as Chair Carter touched on, that's about $10,000 a year in revenue. That amount is consistent with previous years, largely because that system isn't used a lot. Folks before COVID were able to come into the Adult Detention Center and do free video visits on site. With COVID, obviously, we don't want people in the facility visiting. So during COVID, we did amend the contract to reduce video rates to $2 for 20 minutes. That was a pretty good reduction there during the pandemic. So under the new contract for video visitation, we're at 15 cents per minute. We no longer have a minimum charge for services. The costs for on-site visits are non-existent, they're zero. With the new contract, maintenance is included, so we're not paying a vendor to maintain that system. The commission rate to the county was reduced, again, to help offset the vendor costs. There are no transaction fees, and overall, that 20-minute phone call, the old video visitation system was $7.99. Now it's going to be at $3 under the terms and conditions of this contract, which again, were negotiated with the mine to help reduce that burden overall for those folks in custody, but still strike that balance, recognizing that there is a cost to provide the service and that the revenue does help offset some of the operational costs for the jail, which then in turn can help cover, supplies, programming supplies, interpreters, books, any sort of additional repairs and replacements of damaged property. We've used those funds to cover food and hygiene products, bedding, haircuts, those sorts of things.
I thank you for your summary. And appreciate the decision-making process that you're going through as you look at reducing the cost for inmates. There is still the $10,000 that's received as revenue generation by Ramsey County from the vendor. And that is that pattern of revenue generation that I was talking about that we intend to reduce. Are those funds that you will be receiving from the vendor directly related to the cost of providing the service to the inmates? I heard you say supplies, things of that sort, but it seemed to extend to items that may go beyond that, and that is the concern. Could you just answer that directly? Are those costs directly related to providing the service?
Madam Chair, yes. So what we charge the inmate will cover the cost of providing the service, and then also offset that a little bit to help with the operational cost of the adult detention center.
And so there are costs related to providing the service as well as other operational costs for the detention center. And at this level, I am wondering why, in fact, we didn't just take those costs all the way down to whatever the cost of providing the service was. That's the question.
That obviously is a policy conversation between the board and the sheriff on that regard. Any sort of decrease to revenue then would require an increase to our tax levy. Under this contract, we're not going to pay maintenance costs, which were previously around $25,000, plus the revenue piece. So then you're looking at about a $35,000 increase to the overall operating budget of the adult detention center if we do decide to move away from charging for this service.
I will ask for questions from other board members. We will come back to the question for you, Kyle, as to what would happen if, in fact, we were not to make this decision today, but were to lay it over for another time. Commissioner Reinhardt.
Thank you, Madam Chair. As chair of the Budget Committee, I would beg to differ. The decision on how things are paid for is up to the county board. And so if there's an additional cost, that is part of the overall budget deliberation, as that's our core responsibility in oversight. We have made it very clear that we want fees to cover the cost of the service, that there isn't, that we don't expect that there will be revenue that is coming above and beyond that, because we need to be able to make sure that there's not a penalty for being able to communicate, whether it's by telephone or teleconferencing. And so I really want to make that very clear that revenue, as a revenue source, that is not what we have talked about here as a county board, and it is up to us in the overall budget process to determine whether fees or whether there should be revenue. And I think we've made it pretty clear that there shouldn't be. And we need to deal with that in the overall budget. That is absolutely true. But that we do in conjunction with the sheriff's office. Those decisions are not made before they get here.
Thank you very much. I'm looking around to see if there are other questions from commissioners, and if not, we'll ask the Oh, Commissioner McDonough.
Yeah, thanks, Madam Chair. You know, just listening to the conversation, I had some concerns when I seen this, because, you know, I really, truly, this board has been supportive of moving away from fines and fees and to, you know, profiting off of somebody's crisis and potential misery here, right? And so, you know, I think Kyle pointed out, you know, if it's not 10,000 in revenue to help supplement the sheriff's budget and then its property taxes, I would suggest then maybe we should move this forward without the 10,000. And if the sheriff wants to come and ask us for 10,000 in property tax levy, that's up to him to supplement his budget. But you know, there's a point where, you know, as you point out on the telephone one here in 2019, we sent a strong message about wanting to move away from this profiteering off of individuals that come into our system in crisis. And at some point, if we're not getting that response in the RBAs, we should send the RBAs back with that response as a part of it.
Madam Chair.
Thank you. Commissioner Manis Castillo?
I would second Commissioner McDonough's sentiment on that we should move this forward because our folks that are in corrections need to have communications. You know, when we had this presentation in 2019, the data revealed how important it was for families to stay connected and to keep connected with their families. And that was our intent, and we didn't want to create any barriers to that communication, which is why we wanted to reduce that cost. And so, as Commissioner McDonough pointed out, this profiteering from someone's situation is truly disgusting. And I would agree, we need to keep this communication going, and you know, this along with a few other policy conversations with the sheriff would be a welcome, but that we need to move this forward and establish how people can communicate without taking advantage of people in their situation.
So was there a motion, Commissioner McDonough?
Yep, Madam Chair, because I do think we can move this forward. I don't think we have to lay it off. I think we just move it forward minus the $10,000, reduce the contract by that $10,000 that would go into the sheriff's budget for other things that Kyle pointed out. You know, I'm not the attorney here. The attorney probably should, you know, weigh in to make sure we can do that, or if it needs to be structured in a different way. But I do think that this contract should move forward to just cover the fees for us to manage the contract.
I certainly appreciate moving this forward as well on behalf of those inmates and their communication. I do want to call on the county manager. We'll go to the attorney if necessary. We had a small side conversation, and if you could share, County Manager O'Connor, go ahead.
Madam Chair, to specifically answer the question here about the potential motion, because it's a revenue-based contract, there's no money being transferred on the front end from the county. So I think what the board would want to do would be to change the terms of the contract from what is presented here today to bring the cost down either to, and I'll leave this as a choice here, either to only the cost to cover the system, or consistent with what corrections has done, bring the cost down to zero with a direction that the county manager needs to work with the department to identify how that gets addressed in terms of the funding side, which would, I believe, Commissioner McDonough, have would follow the intent of what you were suggesting.
Commissioner McDonough?
So I would test with my colleagues to take it down to zero, as we've done in other parts of the county, and to continue to work to manage, to find ways to provide the service in a way that not only does not profiteer from, but allows the most access to individuals to be able to have connections to loved ones and family members. So I would say down to zero, and I see one shaking of the head.
Okay, so do we have a second?
I'll second that. I have questions.
Before the second, we'll take the question. Go ahead. Oh, okay.
I second it.
We do have a motion and a second. I will take your question. Thank you.
So I'm just wondering what, in terms of just like changing the contract here, that, I mean, that would have to go back and the other vendor would need to accept it. What is that, like removing the revenue piece, will they also be reducing fees then for the costs? Because just removing the revenue without actually taking out the cost piece, what does that do for us? Because right now, the way, I guess the way that I see the contract is set up, part of the way that it's calculated is this commission comes back based on the way it's structured for costs for inmates. So just saying, well, we don't want that revenue doesn't do anything to reduce the costs for inmates. So it sounds like everything would need to be renegotiated then to figure out what is the actual amount we would need to charge to just cover the costs. We can't just take out the 10% commission back.
I understand what you're saying. And I would turn back to Commissioner McDonough to wonder if we could modify this. If we made this a one-year only contract
Right.
and required that it come back to us then to look at future years, that would also require some renegotiation.
And now I'm going to be a little risky, but I was thinking maybe along your lines, but a little different, right?
Okay.
Is make it a one-year contract. I don't have the documentation in front of me. I'm having trouble. So I don't know what the total cost projected is to manage the contract.
Yeah.
You know, is it hundreds of thousands or tens of thousands? Because I guess where I'm going, and this is the risky part, is if we made it 1 year where we use contingency to pay that cost, but then put it in the same way that we did with corrections, that
Yes.
this needs to be managed within the budget of the sheriff's office, working with the county manager in proposed budgets, but setting the policy that we no longer will not only not profit from, but we will work hard to provide as much access to individuals in the system as possible, to family and loved ones. And so moving that forward, I think for the first year, where we would just use contingency, pays for that, but sets up the stage for future negotiation. Now, that's a risk, because I'm with you, I'm sensitive. We need this available for individuals right now. And I don't know that if we send it back and say negotiate between the sheriff and the county manager, we're again putting individuals in the middle of a situation that might not get resolved as quickly as we hope it would get resolved.
I hear you. I am in between where you were as well. So we're looking at this motion, and it has been seconded, and potential modifications to it at this time. I'll call on Commissioner Reinhardt.
Madam Chair, the contract with the vendor is for the actual cost. So that doesn't change if we do this. What does
revenue.
change is what we have to then, and I don't know if that's part, I think the contract with the vendor is what is before us and how they intend to get revenue. So the contract with the vendor, and I'm looking to our attorney here as well, shouldn't change. But what will change is the amount that we charge the inmates. And that is within our control, and it doesn't have any implications with the contract with the vendor, because that is simply for the cost of the services. Now, there's probably additional cost within the sheriff's office.
Right.
So that's, I think the contract with the vendor we could go forward with. That is just that.
And it is a revenue sharing contract with the vendor. There are costs to the inmate which are drastically reduced, but Commissioner McDonough's suggestion is that those costs would come down to zero. I have an interpretation from the county manager. County manager?
Madam Chair, page 5 of the contract, which is commission payment rate and fee information. So section E on, it's page 2 of 20 of the contract, but overall on the agenda items, it's page 5. The contractor understands and agrees to the following. I'll read you briefly what would be paid for. Services for on-site video visitation, which Director Meestad mentioned earlier, shall be provided at no cost. Okay, so there's no cost there already. Off-site video visitation for legal visitation with courts and public defender, no cost. So those two, there's no need to change. The third piece are on all general off-site video visitation shall be provided at a cost established in the pricing schedule. And Director Meestad earlier discussed the pricing schedule. And Kyle, I'm going to come to you in a second in case I've got any of this wrong. But this number 3 describes the pricing schedule that you heard about, being reduced from where it was, but still having a cost. Right now, it is proposed that that cost be addressed through a per minute rate that is passed on to the individual inmate. And so I think what we would do here is suggest that we would get rid of the idea of a cost schedule that involves the individual inmate. So we still have to pay these costs back to the contractor. It would require a financial discussion and fix. Commissioner McDonough mentioned one way that could happen. We could work with CFO Kutza and Director Mistad and the sheriff on what it looks like exactly. But that's to your point of, it doesn't change the overall payment to the contractor, but it's the pricing schedule that gets passed on to the potential consumer. And I would ask it, Kyle knows this better than I do in case I missed something.
Thank you, Kyle.
So I think that's partially right. So in theory, without doing the analysis, we could potentially explore that, but I would caution that going a lesser term as a general rule, a vendor would likely charge more permitted in that circumstance. So, there's equipment, there's a lot of resources the vendor will put into this sort of engagement. So if we do a 1-year term, they come in, have equipment, have the setup, build the capacity for Ramsey County, and we only offer a 1-year term, they may, as we renegotiate the contract, come back at a higher rate per minute. So that's another consideration.
So I hear that, and I'm going to turn to Commissioner Fretham.
Yeah, we can't just pick apart individual terms
Right.
of a contract that's agreed to by the
Exactly.
vendor, and like, we can't just pull that out because contracts, it's a whole thing that they're agreeing to. So you can't just change one term and assume everything else is going to stay the same. And the way I'm looking at this, all the fees are collected by the vendor, so it's not like we could just reduce the prices, that it goes to the vendor. The vendor returns 10% of commissions back. I guess without renegotiating the whole contract to try to figure out what that price point is, that's just going to cover our expenses. I'm wondering budget-wise, as those commission fees come back, whether we do something on our end in terms of determining what are the actual costs of operating the program and determining whether that offset is refunded back to people who use the service. I think that's the only way to approve this existing contract and to not have fees be charged back to inmates. But that would all have to be done internally on our end or budget side. Otherwise, we are going back and negotiating a whole new contract.
Understand, on your point regarding our attempts here to make this work for the inmates and also consider this contract. I know that I'm looking at Commissioner McDonough, he's thinking through, and we are working live here to make changes to the motion that was made. Commissioner.
Madam Chair, thank you. That helps a lot as far as I didn't realize that they collected that and then remitted it back to us. Could we, in this, designate that, and this has got nothing to do with the vendor then, the money comes back to Ramsey County, but it doesn't get deposited into the sheriff's budget, that it gets deposited into wherever the one-time funds that we have, so then we can decide at a later date, we can work through the logistics of what do we do with that? So it's not a pool of funds that is revenue that's specific to the sheriff's office, but it comes back to us.
We could do that.
So it's a budget issue, and we can decide, because we are doing this kind of on the fly today because we didn't have information, but maybe that is one way that we could then decide, okay, can we get it back to the people that have paid it, or how can we make sure that it is used in the way that we would choose to use it as part of our overall budget, which again kind of brings us back to the very first point I made.
Yeah.
These decisions are something that we need to decide.
Thank you. And we do know that there's been a lot of consideration that the Sheriff's Department has put into negotiating this contract. We are trying to make it work, as you have as well, best for the inmates, and considering even more change there. But as we think about the complexity of the contract arrangements and the work that we're trying to do here today, I do see your hand up, Kyle, and then I'm going to turn to Commissioner McDonough so that we think through the best way to look at this in a time frame that will allow us to make the kind of changes we need to make. Kyle, I'll turn to you, and then we'll come back to Commissioner McDonough.
Thank you, Madam Chair, and to Commissioner Reinhardt's point, the revenue that we receive back from the vendor goes directly into the inmate welfare program. That's discussed in the fiscal impact on the RBA. So that $10,000 directly impacts inmate services. It goes to benefit the inmates.
Yeah.
So to Commissioner Fredham's point, if we credit it back, indirectly the revenue, the $10,000 derived from this contract directly benefits inmates. I just wanted to make it a little bit clear.
And Madam
Go
Chair,
ahead.
I am fine with that, but I think that decision is up to us.
As to how that benefit occurs. And
Yes.
thank you very much. So we have a lot of discussion. There are a lot of ideas as to changes that could be made. We don't understand all of the implications at the table today. We're admitting that. But we do know our objective to get away from these kind of concerning revenue contracts. And so in the discussion today, we've talked about a lot. There's a motion on the table. I'm going to turn to Commissioner McDonough, but also suggesting that we may consider a delay here. Commissioner McDonough.
Thank you, Madam Chair. So there's a lot here, right? I mean, Kyle, you're suggesting, the revenue coming back goes into a inmate benefit pool to help with other costs. That's great. But I think the bigger question is, do we want to use revenue generated from an individual that wants to communicate with his loved ones to fund that pool, or is there more appropriate ways to fund that? I think you're hearing from this board, we want to move away from generating revenue based on an individual being in a tough situation. And that means, we want to be able to support inmate benefits, but is it the right way to do it through charging extra and recovering those fees? I would argue no, and I sense my board is suggesting the same thing. And then to even go farther, and this is what we've done in corrections, and a part of the eliminating fines and fees, is there is no charge for that service. They have access to their family and friends without that charge, and we found other ways to pay for that working between corrections and the county manager. And I think that's the other piece that we've been talking about is, ensuring that all our inmates, when they come into the system, have access. It's not based on whether they have money to have access, but they have access to be able to talk to folks. So I would suggest, I think, Madam Chair, you're right. It gets really hard to do these on the fly, and it gets even more dangerous when have the tails and the complications that we just laid out. So I would suggest, giving us a week to 2 weeks to come back after having conversations with the sheriff and Kyle, knowing that the general policy here is to try to bring something back to us that allows access for our inmates and has no charge attached to that. We figure out how we have to pay for that.
So after much discussion, thank you for getting to that point. It probably means that because we have a motion for an amendment on the table, we would need to withdraw that motion. So I'll start with that step. Is that possible?
I would withdraw the motion.
And the seconder? Thank you. So the motion for amendment is withdrawn. We're back then to the main motion, which is on the table. And I'll turn to the county attorney to ask the question, how do we dispose of that? I'm sorry.
We table it.
We could just table it, right, thank you. So I need a motion to
So I
table.
would motion to table
Thank
it
you.
for up to 2 weeks. Sure.
We don't have a meeting
Second.
next week.
Oh, so it has to be 2 weeks.
2
Okay.
weeks.
Okay.
So the motion is to table for 2 weeks. Is there a second?
Second.
Thank you. Motion and second to table, it's not debatable. Would the clerk please call the roll?
Reinhardt,
Aye.
Bretham,
Aye.
Modis Castile.
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega, Carter.
Aye. Thank you very much, Kyle, for being on the phone with us on Zoom. That motion has passed. We will ask the Sheriff's Department to then work over the next week, couple of weeks, to be sure that we get back, and actually it's over the next week, to be sure that we are able to get back a request for board action that eliminates the revenue sharing aspects of this contract. and that continues to reduce the cost for inmates down to zero. All right, thank you very much. Appreciate you all's tolerance during that. And as we make decisions and determinations for policy, we want to be sure that we're abiding by those determinations we've made. So it deserved the time, even as confusing as it was, and we'll get back to it within a couple of weeks. So that is item number 8. I am delighted to move to item number 9, grant application for the Department of Employment and Economic Development for Transportation and Economic Development infrastructure funding for the Rice Street Revitalization Project. Motion?
So moved, Madam Chair.
And a second.
Second.
Thank you. Commissioner Mazzes-Castillo.
Thank you, Madam Chair. I wanted to pull this and just talk a little bit. I know we've talked a lot about Rice Street over the last couple years because it's so important. And also to just point out that this is a different section of Rice Street that we're applying the grant for. So we've talked a lot about the Rice Street redesign, which is exciting, and will begin work next spring, physical work, beyond all the community engagement, which took from Pennsylvania to Wheelock. And this grant is from Wheelock to County Road B. So it going through Roseville and Maplewood as well as St. Paul as part of this continued plan. And I'll just remind folks that this is going to be a dedicated ABRT line as well as the real increased economic generation and corridor of opportunity for our communities. This is a community that is greatly impacted by low income. It's a very diverse community, and so these investments are critical for the success and ongoing vision for the community. So just wanted to highlight that and to call it out, because as we talk about Rice Street over and over and over, that when we get funding, especially for transit, it comes in sections, and so this would be the next section as we continue to do this work moving forward.
Thank you. A very happy comment.
Yes.
And positive information regarding this Rice Street Revitalization Project. We have the motion and the second. Commissioner McGuire.
Thank you, Madam Chair. The three of us really love this project, Commissioner Mazzes-Castillo, Commissioner Reinhardt, and myself. And since I wasn't able to second it because because Commissioner Reinhardt did it, which I'm happy she did, I just want to add my support and say that all three of our cities are really on board with this and have been working hard, as Commissioner Mazzes-Castillo was saying, that we are all grateful for this work of all of our community partners, our city partners, and our county public works, everyone who's working on this. It's just great work, so thank you.
Thank you, and so much. It affects all of our county in terms of the improvement and revitalization of this area. Thank you so much. So we have comments there, and we, I believe, are ready for the vote. Would the clerk please call the roll?
Reinhardt.
Aye.
Fretham.
Aye.
Matas-Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega. Carter.
Aye. Thank you very much. The motion passes, and that concludes our administrative agenda. We're on to a policy item. This is a policy item that is funding for Ramsey County's Racial Equity and Community Engagement Response Team to advance racial and health equity through the American Rescue Plan Act. This is our discussion of that particular work. It will come back to us at our next board meeting then for action. I'll turn to the county manager. Do you have comments before?
Yeah, Madam Chair, I'll keep them brief. Thanks to Prince Corbett, Racial and Health Equity Administrator, for being here today to discuss this. This has been built up. In some ways, this is a continuation of work throughout the pandemic, and then this is the next step as we looked at our tier 1 through 5 continued investment specifically in areas of the racial equity and community engagement work. Using ARP funds was one of the identified tier 1 areas of work. It is not a specific piece of investment as called out in other sources of funding throughout the broader ARPA rescue package bill, but it is one of the areas where impacted communities were highlighted as one of the areas for the direct local investment to hopefully be invested. Mr. Corbett will share some of that information here today on where those pieces come out as they have worked to pull it all together, and then as per course with other areas, we'll be back in 2 weeks after today's discussion.
And I thank you. I welcome Mr. Corbett. I also see our Director of Workforce Solutions, Lynn Becker. And I want to acknowledge that we have someone also on Zoom with us Kamala Pereira, and I know that you'll share also Kamala's work and include her in our presentation. Thank you, Mr. Corbett.
Thank you, Madam Chair. Thank you, Board. Thank you, County Manager O'Connor. So with the American Rescue Plan Act funding, one of the key objectives of ARPA funding is to address systemic public health and economic challenges that have contributed to the unequal impact of certain communities. The work that research has been doing over the past 2 years to address systemic racism because of COVID-19, there are 6 kind of key investment areas that I want to be able to go through. And this fits into the Tier 1 priority areas of ARP funding that the board is aware about. So investment area number 1 is around the Trusted Cultural Community Messenger and Connectors Initiative. So with the spike in COVID cases over the past month, it's 57% of Ramsey County positive cases has been individuals who have identified as racially and ethnically diverse. 19% Black, 10% Asian, 8% Latino if you're looking at certain demographics. We had 3 rounds of Trusted Messenger. With the first round of Trusted Messenger, which is to provide messaging that reached over 500,000 people with over 100,000 Ramsey County residents utilizing social media, radio, and other media to inform residents about COVID-19 health information and county services. So leveraging the Trusted Community Networks, helping residents connect directly to vaccine sites and resources in Ramsey County. With our cultural community connectors, there were over 3,400 Ramsey County residents that were connected directly to Ramsey County services or vaccine sites through our Trusted Cultural Community Connector Project. This partnership is working in collaboration with our St. Paul Ramsey County Public Health Department and Communications as well. Another piece of the Trusted Messenger work is the community conversations. So earlier today, I was glad to know that Dr. Ogawa was doing the community conversations again. Through some of our community conversations and learning about what community thinks or their responses around COVID, being able to take that feedback and adapt the messaging that's appropriate. And with that, we reached over 1,500 Ramsey County residents within those community conversations. The other aspect is we just finished up with our round 3 of Trusted Cultural Community Messengers and Connectors, which focus on increasing vaccine rates in the 55103, 55106, 55130 zip codes from June through August, and that was just completed August 31st, so we're looking at kind of the evaluation of that as well. With our round 2 of Trusted Messenger, and this is why this is important, our community partners collectively reached over 1.5 million individuals, a lot of those Ramsey County residents, in 11 different languages. A lot of the messaging that we're sharing is messaging around that's in different languages that is culturally appropriate. With the investment area investment area number 2 around family coaches, and I believe this is what Kamala is sharing. So this is to implement culturally specific community-based family coaches to assist families with identifying their needs and connecting that family to those services. It's utilizing the family-centered coaching, which is an evidence-based coaching model developed by the Kellogg Foundation. So the family coaches are community partners that really work with families, and I believe that FAS is switching to working with families who are in our sheltering system. So the family coach really works with the family to help that family identify what their needs are and then connects them to the county navigators or other community services. And I don't know if Kamala had anything to share, if she's on Zoom.
I'm here, Prince. I just wanted to add that the family coach model has shifted from the initial setup of how we had it. It was supposed to be something that was supposed to start under the FAS umbrella. However, after communication and after working across departments on the Feel Forward project, we have actually identified it to be more sustainable under the Housing Stability Department. And so that's where I believe Prince is speaking about the Family Service Center and how we are going to implement family coaches in that area.
Thank you. Commissioner McDonough?
Yep, thanks, Madam Chair. Just one quick question on this, because I think this is really important work here and helping us move forward, very supportive of it. I just want to make sure, you know, as we're implementing the family-centered coaching, the family coaches model here, what's going on in individual and families' lives is way beyond the county and what we can provide, and making sure that those coaches are actually, they're not limited to just the services we provide or the solutions we can provide through the county, but cities, schools, nonprofits, all these other supports out there for families are utilized as a part of this.
Madam Chair, Commissioner McDonough, that is absolutely correct. It's working with the family to identify what the family's needs are, and that allows the housing kind of case manager to focus on the housing piece. A family may be coming from another city or another place, and they need to get connected to the school system and get all of that. So the family coach works with the family to identify what those needs are, as well as coaching the family on how to navigate different county, community, different systems, so that they have the information so that when they go ahead, kind of moving forward, they have those skills. It really helps a family develop executive skills function and identifying what the goals are, what barriers get in the way, and that's what the family coaching model does.
Thank you.
Thank you. And, that also can help to break down walls within Ramsey County. So whether it's early childhood or workforce or corrections, mental health services, family coaching would suggest that we are able to help with whatever needs that family might have, and to engage then those areas of work even within Ramsey County in a collective manner. Would that be correct?
That is correct, Madam Chair.
Thank you. Other questions? Prince, go ahead.
And investment area number 3 is around the racial equity plan. And this came up from our EAC Policy and Practices and Workforce Committee. So it's to start the development of a countywide racial equity plan by looking at the current areas and conditions, and also the development, it should be a biannual racial equity employee survey. So with a lot of racial equity plans, a lot of it focus on our internal systems, processes, and cultural change. And it's really to help fund to start the development of the racial equity plan through a project manager, as well as developing a biannual employee racial equity survey. And this survey really measures employees' mindsets about racial equity, their knowledge about racial equity, so we can start measuring where progress is moving forward, as well as where there may be any gaps. And investment area 4 is for continued support of the Equity Action Circle. So it's really to provide the compensation for EAC community members so that the EAC is still together as we continue to deal with this pandemic. And then I'll turn it over to Director Becker for just 1 second, just one more area. Sorry about that. Investment area 5 is the COVID response, engagement, and outreach. And this, once again, is a partnership with Public Health to continue the Mask for Everyone project, focusing on targeting families with children under the age of 12. Our vaccine incentive, which has been very popular, and providing $100 Visa gift cards incentives at vaccine sites, and then also supporting vaccine public sites in collaboration with Ramsey County Public Health. And now, Director Becker to talk about digital equity.
Thank you.
Good morning, Madam Chair, Commissioners. So throughout the pandemic, we have seen a bright light shown on the gaps in our community when it comes to access to technology, connectivity, and digital literacy. These gaps are significant, particularly as we look at the acceleration of the future of work and ensuring that all residents will have access to high-wage and high-growth jobs. Being as diverse of a county as we are, we need to ensure workers of color have equitable opportunities to all of these things. And so tech equity continues to be a significant barrier in our community. Through your past investments, through CARES Act funding, we were able to work in close partnership with the City of St. Paul, and that included our investment in Tech Packs, which was actually highlighted by the Minnesota Department of Education as a statewide model for closing tech equity gaps. We opened career labs in person earlier than any other county in the state in partnership with Public Health. And while those responses were of immediate urgency, we need to start thinking about what recovery looks like, ensuring that it's an equitable one. So we know that the digital gaps are not only in the workforce area, rather in the tech packs we learned that as soon as we gave people access to equipment, digital literacy, and in connectivity, they were able to enhance all aspects of their lives, including a variety of access to county services. And so over the past year, we've been coalescing around this topic. We've been bringing department leaders from throughout Ramsey County together. There's been a work group led by Director of Policy and Planning, Elizabeth Tolzman, in partnership with myself, also the CIO, Rich Christensen, and also Jennifer Schuster-Yeager from the Health and Wellness Administration. And so we've also brought in other leaders from FAS, from service centers, from libraries, to really just deepen our own understanding of where gaps are in the county and to align the work that we are already doing that's part of the different departments that we're a part of. So what I have before you today is a request to fund a connectivity blueprint in partnership with the City of St. Paul. We basically need to develop a guiding document through some help of consultants and also be able to hear from community as to what those needs are. Both organizations are going to be leveraging dollars in. We'll be leveraging some ARP dollars. The City of St. Paul has some St. Paul Minneapolis Foundation dollars. They'll also be aligning some staff to help support this work. And it really will give us then kind of an even understanding and to bring back to you as well as the City Council to guide some of the future conversations. And so we all know this issue is bigger than any one organization can tackle. We need federal, state, and local policymakers and philanthropy and businesses to all help us. But most importantly, we as a county have the ability to ensure community is brought to that table as we have those conversations. And so this funding for this connectivity blueprint is a first step to that. So happy to take any questions you might have.
Thank you. County Manager.
Madam Chair, I'll just close with two pieces. I want to appreciate the amount of work that's led into the presentation today. This has been a number of rounds over the past 2 months as we worked to sort out what we need our departments to continue to do, but where the catalytic investments need to happen, where we need to continue to make investments along the continuum of racial equity and community engagement. The digital tech equity is a newer piece to it. We've been working hard to figure out what is our role in this space, and the blueprint and that vision piece with our partners is the first of many steps that will involve all the partners Director Becker mentioned. There's one last comment I'll make that we will change before the official administrative RBA comes through. In the fiscal impact, it mentions a total of $2.72 million across everything you just heard being requested annually. So I would strike annually. It's being requested for the period through the end of 2022. That just was a typo on our part. So it is $2.72 million. We'll clarify that in the final piece, and we'll stand for any questions. Thank you.
Thank you very much. And of course, this last piece regarding digital equity has become so much more obvious and important as we've been going through COVID-19, and this is our way of communicating and doing our work. It becomes so obvious that it will continue to be more and more important. I just wanted to underscore that the community engagement you're talking about certainly has to be separate and focused on digital equity, but also we have every opportunity to integrate that work and align it with the community engagement that is already so important to us in every aspect of the work. I just wanted to make sure that as we continue that work, we're embedding in it learnings about digital equity and who we're able to communicate with and how, how we get those gaps, how we plug those gaps together with others in our community. It's separate, it's a separate conversation, but it's also integrated, I would hope, into everything that we're doing. I see you nodding. So we have ways of gaining that information, doing the surveys, et cetera, in companionship with the work we're already doing. Thank you. I think I see Commissioner Matas-Castillo.
Thank you, Madam Chair. I just want to say this is a really great presentation and a really wise use of these resources. You know, a couple of years ago when we said we were going to put racial and health equity on the forefront, I feel like we're really living out those values, and it doesn't happen unless, we can say a lot of things, but if we don't put the resources behind it, it doesn't mean anything. And this is just another example of us saying, no, we're putting our money where our mouth is because this is important and we can't make the changes that we want unless we invest. And so I know you said it's a typo of annually, but wouldn't it be great if only it could be, and we had those resources available, in the future, because this is so important to make sure our entire community thrives. So thank you for the work on this. Thanks for all the people that worked with you to put this forward. I look forward to supporting it when it comes back to us.
again, addressing the long-term work that we have to do. Commissioner McGuire?
Thank you, Madam Chair. Yes, this is great work, and just thank you so much for all of it. I'm just gonna just highlight what I believe to be the case, that, you know, in item area 6, the digital equity, that it's in partnership with the city of St. Paul, but that work, that connectivity blueprint will then be used throughout the entire county so that all of our cities will be able to benefit. And I know that you're out there all the time in all of our cities doing all of this really important work. And so we're just grateful for these blueprints that can just help all of our residents. So thank you for that.
Yeah, Madam Chair, Commissioner McGuire, I do want to emphasize this will be a countywide connectivity blueprint. We wanted to leverage in the St. Paul staff and dollars, but the Ramsey County share will ensure that it's a thorough study of the whole county.
Thank you. And investment from all our partners is certainly welcome, as well as creating that blueprint. Commissioner McDonough?
I'm fine, thank you, Madam Chair.
Thank you. All right, thank you so very, very much. Was there anything that you had in wrap-up?
I did. Director Holly, did you want to add any last comments? This was truly in partnership and collaboration.
Thank you.
First, I just want to thank Administrator Corbett for all his continued work on the efforts and on behalf of Research. The last 18 months has been a long journey with community, and we're so looking forward to building and extending and sustaining this partnership through public health. And so again, we've done this in partnership, and I just want to truly thank the board and county manager for the continued support of our racial equity and community engagement response team. We've been on a long journey, so thank you.
Absolutely. This is incredible work, and we very, very much appreciate it. As Commissioner Matas-Castillo said, this is really walking the walk of equity and community engagement, and it is the investment that we need to make sure that will be true in Ramsey County. Thank you so very much. This, again, is a plan coming before us today, and it will return to us at our next board meeting, so that we can put our support behind it. Thank you so much. Remaining in our meeting, then, we have County Connections, our outside board and committee reports. We also have a Regional Rail Authority meeting coming up, so I just wanted to make sure we have a gauge on our time, checking with County Manager for connections.
Thanks, Madam Chair. Just one update today. Last Monday, I had the opportunity to convene 2 budget town halls. One focused on employees around 12 o'clock in the afternoon, and then one in the evening at 6 o'clock, focused on ensuring community members had an opportunity to attend. They're both virtual, and it was an opportunity to present the same budget documents that you all received a few weeks ago, and present the strategic vision of the budget to a broader stakeholder group, take some questions and discussion there. That was a new format. We haven't done that in that way before. We had about 100 folks from inside the county attend during the afternoon session. About half of that then attend the community conversation in the evening. Commissioner Reinhardt, as chair of the committee, was at both meetings as well, so thanks to her for attending. And in general, I think what I would say is the questions were thoughtful, the discussion was good. I don't want to oversimplify. There are areas, of course, where there's challenge in saying we have so much work to do. Particularly housing stood out in the community session in the evening. Some of the conversation on health insurance came up with staff earlier in the day, but Administrator Corbett was our facilitator of both conversations, and at the end asked people, was this worth your time? And so a couple of questions, and felt really good that many said they've never been invited to a budget conversation like this. This was a great way to hear the budget from the balcony view. And I appreciate everyone for taking time. It was a beautiful night out, so the fact that anyone was willing to come to a budget meeting was greatly appreciated. And now we look forward to budget meetings with all of you starting this week. That's all I have.
Sure. I have a question about that, only because you're mentioning these public hearings. And we have our budget public hearing a week from today, on Tuesday the 14th. And is that going to be in person then, or is that on Zoom, or that's our traditional public hearing that we usually do in person, right? And we're having it here in the board chambers at 4:30. And so do we stay tuned if we've decided whether or not we want to bring in members of the public to a public hearing. I mean, I think we may be deciding to do it on Zoom, or I'm just curious.
And so, Commissioner.
Madam Chair, I believe that, as was stated earlier, we have to be flexible.
Yeah.
And so I would suspect, unless something major changes, that it will be virtual.
And so we
That-
will
that-
communicate, yes, any
Yes.
changes that we are making. Currently, it is scheduled to be here.
It's scheduled for 4:30. We noticed the time of the meeting, and the location can be a little bit flexible. We'll confirm
Yes.
on Thursday morning at the start. We'll work with the budget chair.
Okay.
So when we get going on Thursday, we'll be clear on that.
Thank you.
I support that.
Well, and I guess the bottom line is, whether it's Thursday morning or whatever happens, or county board meetings in this room, a lot of that will be decided very
Within a
soon.
couple of days.
And
Right.
we are flexible enough to be able to deal with that. So it could be, or, it could change
Yes.
in 5 minutes. Who knows?
Stay tuned.
The way things
is
are
the
going, it can
answer.
change.
Thank you.
So we will accommodate whatever we need to do at that time.
Thank you. Stay tuned. All right, so that is our county connections. We are going to move then to our board reports. I started this way last time, so I'm going to start this way this time. And we have a little bit of time before our regional rail.
Okay, I'll be quick. Thank you, Madam Chair. A couple updates. As you know, with the Great River Rail Commission that has been around for many years, was successful in securing the $10 million for the second train. And we're now looking forward to seeing what's next, comes with sustainability and continued improvements, and to make sure all those improvements come into place. But in that vein, Dakota County has already announced that they are withdrawing. They do not have any of the proposed stops. They stuck in it to secure the money, but they are pulling out. And Washington County is also indicating that they may as well. So it's a little bit of overturn. We're really thinking about how we can keep folks together. But again, it really is going to come down to what's the future of the work plan? What does that mean now that we've secured funding? And how do we maintain that moving forward? But just wanted to share that news with you all. I also had the opportunity to attend the graduation ceremony for the at-risk youth training, which is a graduation of community that came together to train specifically outreach folks to interact with our Asian youth. This came out of some of the violence that occurred around the Frogtown Rec Center a few months ago. And St. Paul PD partnered with our community to say, let's do some training that includes de-escalation, what other services are available. And so they've created ambassadors specifically to work with our Asian youth as we work in the community. And it was a really great event, and to hear the impact from our Asian community. It was a focus on Karen and new immigrant youth in particular, as well in partnership with our Hmong community that are working about that experience. And then lastly, I toured the Emerge Second Chance mattress recycling. So I ventured across the river to go over. It's a really fantastic program that helps folks who have high barriers to employment, many coming out of incarceration, to get trained in good jobs and work skills. And they stay usually in the program 6 to 9 months before they're placed in a higher paying, better job, more permanent. They are looking to come to our side of the river. They have picked a location in the north end that they're eager and excited about, and so looking to see what kind of advancements. And we are doing some pilot projects already through the Recycling and Energy Center in communities and some public housing in St. Paul for that mattress recycling. We all know that it can be a challenge. The really exciting thing is that of the mattresses that when they recycle, they actually are able to recycle 96% of every mattress delivered, which is quite amazing. And that produces then a revenue to continue to fund the program. Plus, they serve about 1,500 folks a year in job placement. So it's a pretty remarkable program that we would be excited to have them on our side of the river. So with that, Madam Chair, I'll pass that along.
Thank you very much. Commissioner Reinhardt.
Madam Chair, I'm smiling underneath this because we have come a long way. I remember going way back when we installed, which of course we don't have to, basically we installed equipment at the Recycling and Energy Center to simply shred the mattresses. And we have come such a long way. And I think it is important to note that recycling is not only good for the environment, it is good for the economy, it is good for work skills. Overall, this is something that recycling is a major economic driver of jobs in Minnesota. And I know that the Minnesota Pollution Control Agency has data on that. It's truly a driver. And people think of it as something that's kind of on the side or extra. It really isn't. It is a driver, economic driver. First of all, as far as I've just got two quick updates. One is listening to the community conversations on the budget was really, it was so engaged, and everyone was participating, or there were a lot of people on the call, but it was something that was really interesting to hear and to see, and I'm so glad for everyone that participated and for our staff for pulling it together, because this was a first, but it's not the last. Then the only other item that I'd like to highlight is the Clean Water Council Policy Committee met and are offering up a resolution or a recommendation to go to the full Clean Water Council, which I also intend to bring to the AMC Policy Committee, and that is a position on funding for the underground utility mapping, which is not only an environmental issue because there are many, many miles of unmapped, basically, underground utilities, which of course is also a public safety concern because of the accidents that can happen just because the people that are working in an area doing development aren't aware of where all these lines are, and there have been accidents that have been pretty severe at times. The biggest issue is, of course, the data safety or protection of the private data. And there are many examples of how that's been able to be accomplished. So it's not really a cost to government as much as it is protecting the data, not only because of public participation in this, but because of security issues as well, making sure that the data doesn't get moved around too broadly, I guess. The privacy is protected. And there are ways to do that, but it does require legislation. So, and I'm keeping our staff informed of this as well, but I intend to bring it to AMC because I think it's important for across the state. And I guess that's it. There have been so many different things. I mean, it seems like our last board meeting was way more than 2 weeks ago. It is amazing how much can be fit into that. I will say that one other thing is that I was scheduled to volunteer at the state fair, which I do every year. And I chose not to do that because of trying to model the behavior that we expected. And I wanted to make sure that that message of how critical this is, and not that people were doing in the particular booth that I volunteer in, people were following all the protocols, but I felt that it was important for the public as far as modeling behavior that we expected. So, thank you.
Thank you very much. Commissioner Fretham.
No update.
Thank you. Commissioner McGuire.
Thank you, Madam Chair. Just a couple of things, and it has been a while since we've given reports, but just to Director Lingbecker, who appeared at our Roseville Business Council meeting a couple weeks ago now, and just spoke about the connections that we make with all of our communities in Workforce Solutions and how we connect with businesses. And she always just does such an amazing job in making those connections. The community, the businesses out in our area really get to know Ling, and she just does such a great job. So many thanks to her. Also coming up this Friday, Ramsey County League of Local Governments is having actually a Zoom meeting with the mental health panel. So we're continuing our focus on mental health issues in the county, and so it'll be a great panel discussion. I know Mindy Greiling is going to be on that, but it's with NAMI, Ramsey County NAMI board members, which is National Alliance for the Mentally Ill. And so that's this Friday from 7:30 till 9. And everyone would be invited to that. Also next week is the AMC Policy Conference. I know a number of us are, well, hopefully most of us are all going to it. It is really important that we have our voices at these policy meetings. I know that our county manager is presenting there. I'm speaking on some issues, but a number of us will be would be very active in our committees, and that's Thursday and Friday. There's a board of directors meeting on Wednesday, so just wanted to let people know about that.
Appreciate it. Commissioner McDonough?
Madam Chair, I would love to report since last Monday and Tuesday were fifth Mondays and Tuesdays and the pre-holiday weekend. I got to spend time with Carol and Peggy and my children and grandchildren. Yay. And a part of that, I got to celebrate my mom's 89th birthday. So.
Yeah, that is a very big deal, and thank you so much for sharing with us the joy.
Exactly, it's such a good idea.
I just want to mention that although Commissioner Ortega is not here with us today, we know that he is recovering and he will be returning to our board shortly. And we just want to make certain to send out warm wishes to him and acknowledge his absence. I would also share that recently this weekend, there was an unfortunate accident in Ramsey County that involved the loss of life of 2 young people. And certainly our Ramsey County deputies who were involved were also impacted. Just want to send out warm thoughts and our sympathies to those families, acknowledging their loss and all of our loss. And certainly as we were in our moment of mindfulness, I know we were thinking of them and will continue to do so as we explore and get additional information regarding that accident, and our just best wishes go out to them. So before we adjourn, I'd like also to mention that we have our regional rail meeting coming up here in the council chambers, and at 1:30 today we have our strategic team committee of the whole meeting. It will be on updates to our workforce statistics and also to our public pathways program that will be in our county board office, and there is a Zoom link available for those wishing to attend and or observe. The Zoom link is posted on our site. Regional Rail meeting will be covered by Vice Chair of Regional Rail, Commissioner Reinhardt. And with that, our board meeting is adjourned. Thank you.